Hello and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and today I'm joined by 4 diabetes care specialists in honor of National Diabetes Awareness Month, which takes place in November. Today, we'll be discussing all things diabetes and the importance of meeting with certified diabetes educators to help you navigate this condition. We'll talk about the differences between pre-diabetes and diabetes, as well as the latest technology. So if you or someone you love has diabetes and needs help to become healthier, stick around, share this broadcast with your friends, give us a like, let us know you're watching, and please ask your questions for our experts in the comments. So before we get started, let's meet our experts. We'll start this morning with Lynn.
Good afternoon. Thanks for having me, Karen. I'm a nurse here at MedStar Union Memorial Hospital, specialized in diabetes education. And I'm happy to be here today to chat about diabetes and answer any of your questions.
Awesome, thank you. And Lorraine.
Hi, everyone. I'm Lorraine Giangrandi. I'm a diabetes educator as well and I'm also a registered dietitian. I've been a dietitian for almost 30 years now. Thanks for having me.
Oh, yeah, of course. Okay, Melissa.
Hey everybody, my name is Melissa Santini. I work over here at Good Samaritan Hospital, and I'm also a dietitian and certified diabetes care and education specialist. And I'm excited to get started today and help you celebrate Diabetes Awareness Month.
Wonderful. Yep. Thanks for being here. And finally, Carrie.
Hi, everyone. I'm excited to be here as well. I also am a registered dietitian and a certified diabetes care and education specialist. And I work at MedStar Franklin Square Medical Center, and I've been in the Nutrition and Diabetes Education Center for the last 17 years.
Wow. A lot of great experience on this call today. Thank you all so much. So we have some questions for you. And to get us started, I'm going to go to you, Carrie. Let's start with the basics. Can you tell us what is diabetes?
Sure. Your pancreas produces and secretes a hormone called insulin, and that helps regulate your blood sugar. When your body doesn't have enough insulin, or that insulin is producing isn't being used efficiently, then your blood sugars will start to elevate. And if they get up to a certain level, then that's when you're diagnosed with diabetes. So it's uncontrolled blood sugar.
Okay, thank you. And what are the symptoms of diabetes? How would someone know that they are experiencing potential symptoms of the disease?
Oftentimes, the number one symptom is thirst. And every symptom I'm going to share with you are things that we all experience, but they're excessive. So it's excessive thirst. And therefore, as a result of that, you're drinking a lot. And so there's excessive urination. A lot of times you're getting up in the middle of the night, sometimes multiple times to go to the bathroom. It's more than normal. Hunger sometimes will be a symptom, even if you've already eaten. Fatigue, again, excessive fatigue, where you just don't have the energy that you normally have. Sometimes you may experience some blurry vision, or if you have a cut or a bruise, you may notice that it's taking longer to heal than normal. If you experience any of those symptoms, you should talk to your doctor about that.
Okay, good to know. And great to know the distinction between what we all experience versus excessive thirst, like you said. So I know that there's a difference between pre-diabetes and diabetes. Can you talk about what those differences are?
Sure. I like to refer to pre-diabetes kind of like a yellow light. It's a warning. It's letting us know our blood sugars are running higher than they should, but they're not yet to the point that we would diagnose you with diabetes. So that's basically what it is. It's just higher than normal blood sugar is pre-diabetes. And there's a lot that we can do in terms of education and moderating lifestyle changes to prevent those numbers from getting into the diabetes range and even returning them back to a normal range.
Okay, thank you. So it sounds like it has to do with your blood sugar and the level that it gets to. So if it's just high, it's pre-diabetes, and then if it gets to a certain point, it's
Yes,
considered diabetes?
and there are specific numbers.
Okay,
I'm happy to get into that. We
that's okay.
typically will diagnose diabetes or prediabetes using something called an A1C. And we do
Hmm.
that because if we just check your blood sugar, that just kind of tells us what your blood sugar is at this moment in time. But an A1C gives us an average blood sugar reading of where you've been for the last 90 days or 3 months. So it gives us a much, much bigger overview of your overall blood sugar control. And we expect that number to be somewhere between 4.0 and 5.6. If that number gets up to 6.5 or greater, that's when we would diagnose you with diabetes. But there's that whole middle range of 5.7 to 6.4 where those blood sugars are running higher than they should, but they're not yet in that diabetes range. So that's actually where we love to catch somebody in that pre-diabetic range to try and intervene there as much as possible to help prevent those numbers from getting into the diabetic range.
Thank you. That's really helpful. So what if someone is diagnosed with diabetes? How would they be treated?
Well, there's lots of different things we can do. I always say if you have to get diagnosed with diabetes, 2024 is the time to do it because there's so much available to us. But definitely lifestyle, that's a big one. And that's where a certified diabetes educator can help a lot with that. But there's a lot of medications available on the market, both injection and also oral in all different classes that do different things. And then monitoring your blood sugar. Everybody that has diabetes should have a glucometer or some way to monitor their blood sugar and know what those normal blood sugars should be and how to kind of adjust if they're running high or low. And then talking to your healthcare team. So your doctor, your dietitian, your diabetes educator, we will all work together with you to kind of find the best treatment plan for you.
Okay, great. Thank you. So why do so many people have diabetes? And how many people, like, do you have a sense for how many people can get diabetes or that get diabetes?
Right now, over 34 million people in the United States of America have diabetes. So it's roughly 10% of our population. So it's a lot. Now, why does that happen? Well, the numbers have been going up. So while we don't know exactly why, we think it's probably related to our obesity levels have been going up, and obesity is a major risk factor for diabetes. In addition to that, a sedentary lifestyle puts you at higher risk for getting type 2 diabetes. Now, more than 90% of people that get diabetes have type 2 diabetes. So that's what I'm referring to when I'm talking about these risk factors. So, and again, in the United States of America, we're becoming more sedentary. Also, having a diet that's very high in processed and convenience types foods, that can put you at higher risk. So again, in the United States, as over the years, we've become more sedentary, having more processed foods, gaining weight. So all of those things have put us at higher risk of getting type 2 diabetes in particular.
Makes sense. Thank you so much, Carrie. Appreciate
You're welcome.
your information about diabetes basics. Now I'm going to turn to Lynn and I'm going to ask you some questions about education. And I'm going to start with what we're doing today. Why do you feel it's important that our patients, the viewers watching today, have diabetes education?
Diabetes education provides people with the knowledge, the skills, and the personalized support needed to manage your diabetes. It really helps people achieve a better quality of life.
Yeah, makes sense. And that's obviously important if you want to live a long, healthy life. So, what about some strategies? What can be used to help patients manage their diabetes?
As Kerry kind of touched on, healthy eating. Healthy eating is key to helping to manage your diabetes. We recommend reducing sugar sweetened beverages. We recommend a healthy diet with fewer calories, with fewer carbohydrates, with fewer saturated fats and salt. And of course, any weight loss is really helpful with managing your diabetes by decreasing insulin resistance. Another way to manage your diabetes is exercise. Exercise can be quite effective at, managing your diabetes. Most adults should get about 150 minutes most days of over the course of the week. And it can be walking, biking, gardening, anything that you enjoy. Medications, of course, is another strategy to manage your diabetes. And we recommend taking the medications as the doctor prescribes it and knowing that different medications work in different areas of the body. And that's why people are often on more than one medication.
Mhm. All right, thank you so much. How do you get to see a diabetes educator as a patient? What is that process like?
Right, you would ask for a referral from your doctor, and then, they perform an insurance verification and call to schedule an appointment.
Okay, and thank you. And what does a diabetes educator do to support the patients?
Oh, we have a lot of tools that we'll use to support the patients. We've got support groups, we have technology, we have lots of information about, carbohydrate counting and meal planning, better choices, maybe more fiber, so we can help patients with any of that.
Okay, great. Is a diabetes educator covered by insurance?
Insurance coverage varies, but most insurance plans cover, some amount of diabetes education, including Medicare and Medicaid.
Okay, good to know. And is it a one-time class that you go to, or is it something ongoing that you receive?
Yeah, diabetes education is generally an ongoing process. With the initial class, we'll teach people how to check their blood sugars. We'll teach basic meal planning, exercise, target glucose levels. And then, of course, the follow-up classes provide more personalized meal planning, setting some goals, seeing how they're achieved. And of course, everything can be adjusted. Um, Technology, as I mentioned, it can be helpful, with the ongoing classes, and then of course support from us, from your family, from your friends, all helps to manage your diabetes.
All right, thank you so much. So, if you're just tuning in, thank you so much for joining us. November is National Diabetes Awareness Month, and we're talking about all things diabetes with 4 of our diabetes care specialists. We're talking about the differences between prediabetes and diabetes, the latest technology, and the importance of meeting with certified diabetes care educators to help you navigate this condition. So again, if you or someone that you love has diabetes and needs to become healthier, I encourage you to continue to watch, share this broadcast with your friends, and ask your questions in the comments. We'll take some time to answer those as well. So far we've talked about our diabetes basics as well as diabetes education. I'm going to turn now to Melissa. We're going to talk about technology. So Melissa, can technology help someone who is diagnosed with diabetes, and how?
So diabetes is a lot of work. There are a lot of tasks that somebody has to do during the day when they have diabetes. I read a recent statistic that the average patient with diabetes makes 180 additional decisions a day than the average person. So those are decisions about food to eat, medication doses. Do they have supplies if they go low? Do they have something to eat with them? So many decisions, and it can be a little burdensome. So technology can really help reduce the burden of all of those tasks and really kind of help shift the focus from always thinking about diabetes to really being able to think about their life and what they want to do.
Sure, that makes sense. Wow, that's a big statistic. The number of thoughts and questions that someone with diabetes has to ask themselves, that's probably very overwhelming. So that's great that there's technology available for them. What types of technology is available?
So I would say in the last decade, we've kind of had an explosion of technology. We have, anything from something as simple as a smartphone app where you can track your meals or it can help assist you in making insulin dosing calculations. We have our continuous glucose monitors, which are little devices that you pop on your skin and they kind of take away the painful and frequent need for finger sticks. The CGMs are super helpful in helping the doctors assess effectiveness of medications, and we can really help them determine if their diet is, causing these blood sugar spikes or drops. There's smart pens that are actually little devices that connect to an app on your phone, which tracks your insulin dosing. So really, really helpful for the docs to see if patients are missing doses or if the dose is effective enough for what they're eating. And then really, all the way to a actual insulin pump. So these are automated insulin delivery systems, which can actually adjust insulin in the background. Sometimes they can give you correction doses or actually meal doses of insulin without the user having to do much of anything. So there's tons of new technology out right now that are really exciting and really helping to reduce that burden for patients.
That's great. And if a patient has concerns about using technology or they're a little timid about it, maybe it's not something they're used to or comfortable with, or maybe it's a trust thing. But if someone is concerned about using technology to help with their diabetes, how do you coach them?
So you're so right. Like technology can be super intimidating, especially for somebody who's not super tech savvy. So we never pressure anybody into, using technology. But what we can do is we can have the patients kind of come into the clinic. We can identify their goals, like what do we hope to establish or achieve with this technology. So once we kind of figure out what the patient's looking for, we have a number of devices that we can show them. We have demo devices in the clinic that they can touch and play with and see what it feels like to use. There's simulator apps and simulator websites where you can actually go in and play around in these different devices. And then once we kind of figure out, if this is something that works for them, patients would always have a really robust training prior to getting onto the device to make sure that they really understand it, they really feel comfortable. And typically somebody will follow them for, a couple weeks into the use of the device just to make sure they're feeling good about it. So, I think it's really, the technology has become very user friendly. So I think once they're able to kind of look at it and play with it, it kind of eases the fear a little bit. And just knowing that, they have us for support, anytime they have questions, they can reach out to us. Hopefully that eases the fear a little bit.
Yeah, absolutely. It sounds like it could, and that's great that there's that offering available because, yeah, it's hard to get into new technology when you're not familiar with it. So I love the simulation. All of those approaches sound like they could be really effective in helping a patient use that technology and use it appropriately. So what does the future of diabetes technology look like?
So I think it's super exciting. I think these devices are getting smarter and they're getting smaller. And I think, I think it's not too far off where we're going to have kind of a closed loop system where patients can kind of put these insulin pumps on and be totally hands off. So the pumps will kind of take care of all of these things for them. So I think that, I think we're really close to that. And I think it's going to be really exciting to watch what kind of comes through over the next couple of years with this technology.
That's great and exciting. Thank you so much, Melissa. Appreciate it. I'm going to turn now to Lorraine. We're going to talk about misconceptions about living with diabetes. And I'm going to start by talking about food. So we talked about diet already. So our viewers might be thinking to themselves, do I have to avoid my favorite foods when I have if I have diabetes?
No, you don't have to avoid your favorite foods if you have diabetes. You might need to eat smaller portions of that food. You might need to eat that food less frequently, but you should still be able to fit those in. And I would say it's really an opportunity for that person who has diabetes to set up a meeting with their certified diabetes educator or their dietitian to have a conversation about how they can fit that food in and to understand how it impacts their blood sugar and and like I said, have it fit in while keeping their blood sugars in range.
That's great news. Thank you so much. What do you say to patients who don't understand why they were diagnosed with diabetes and they don't have a family history?
Right. So while family history does play as a risk factor, there are many factors that can contribute to the development of diabetes. The first one that comes to mind is age. So once you're age 45 or older, it's much harder for our bodies to regulate glucose. So age is a risk factor. Carrie had touched on this earlier, but these are two lifestyle factors, one being if you're overweight or obese, puts you at greater risk of developing diabetes, and if you're physically inactive or sedentary. So today, with all of our computers and stuff, Americans are sitting down a lot more. We're not moving our bodies like we used to. So those are two big risk factors, especially for type 2 diabetes. There's other information that's coming out about sleep and how poor sleep duration can make it harder for us to have good blood sugar control. Medications can even contribute to the development of diabetes, like steroids or even antipsychotic medications. And even infections or viruses can contribute to the development.
Okay, thank you so much. So we've talked about the risk factors for getting diabetes, including the sedentary lifestyle that was mentioned a couple times. After someone is diagnosed with diabetes, should they continue to exercise?
Absolutely, absolutely. In fact, I love having the chance to meet with somebody who is new to diabetes. A lot of times when they meet with us, they want to know a lot about how, what foods they should eat. And while that is super important, I would say it's also equally important that they understand how exercise impacts their blood glucose. And it's probably a large misconception. A lot of times I will ask the patient, how do they think exercise is going to benefit them? And they will often say, well, maybe it's for fitness, or maybe it's for me to, lose weight. That's why I exercise. But I think a lot of people don't realize that exercise can actually help naturally lower your blood sugar. And it also fights something that we call insulin resistance. So when you have pre-diabetes or type 2 diabetes, it means you're making insulin, but your body is not using it very well. And physical activity can really help you have better blood sugar control. It helps that insulin work better.
Okay, good to know. Thank you. We did get a question from our audience from Mildred. Thank you for posting your question and watching. This question is, I've heard many people eating a carnivore diet have found great success in controlling diabetes. Do you have patients who have followed this plan? Lorraine, if you could answer that, or someone, you can turn it over to someone else.
Yeah, when I think of a carnivore diet, I think that it's high in protein and low in carbohydrates. And I do think that it can produce, better blood sugar control. But I would say there's two thoughts that come to mind, or concerns. One is the saturated fat that you might be taking in from eating a lot of meat. So if you are taking animal protein in, it's good to make sure that it's lean. But also sustainability. When we look at people who consume lower carbohydrate diets, usually after 1 to 2 years, there's a period where they come off of it and they're not able to stick with it. So that would be my concern. And the other thought is just, you don't want to have so much protein that you exclude plant foods from your diet. Plant nutrition is really important. We know that there's components in plants other than vitamins and minerals that protect our bodies against disease.
Great advice. Thank you so much. So I'm going to turn now to the group and ask for your final thoughts. We have gone through all of our questions, but there might be some additional information that you want to make sure that our viewers take away from our discussion today as we continue to celebrate National Diabetes Awareness Month. So I'll just go around and ask for your final thoughts, and I'll start with Carrie.
Okay, great. I have one thing just to kind of add on to what Lorraine said as well. I think when we're talking about some of these fad diets and things like that that people have heard may help diabetes, our human brains, they just want to categorize everything into a bucket. So you're watching a movie and you see the bad guy and the good guy, and the bad guy's all bad and the good guy's all good, right? That's just how we want to think. But when it comes to food, many times something can be two things at once. So fruit, for example, it's entirely carbohydrate. It absolutely will raise your blood sugar. And it's loaded with vitamins and minerals and fiber and antioxidants and all these things that are really, really healthy for you. So we don't want to eliminate it from our diet. So it's not good or bad. It's just all those things. It is carbohydrate and affects our blood sugar, and it has vitamins and it has minerals and all those things. So that's again where a diabetes educator or a dietitian can really help you kind of navigate those things. You don't need to do any kind of extreme fad diet. But I guess my final thought is just while diabetes is a bit of a bummer when you find out you're diagnosed with that, there is a lot that you can do to control those blood sugars and a lot that we can help you with. And as long as your blood sugars stay well controlled, you absolutely can lead a long and happy life and healthy life and happy.
Great advice. Thank you so much. Appreciate it. And Lynn, final thoughts?
He said it's a chronic disease and it does have to be managed, but it certainly can be managed with all the new information, the devices, the medications that we have now. Complications do not have to happen, and certainly we want you to take time to enjoy, what you do, what you eat, and kind of nothing's forbidden.
Great advice. Thank you so much. Melissa, what are your final thoughts?
So I guess I would just want to let everybody know that there is a ton of inaccurate information out there. I can't tell you the amount of patients that come in with these questions that, or things that they've been doing that are totally off the wall and totally don't have any backing in science. So I would say, if you're sifting through the internet and you're really confused about what to do, I think that's really one of our best ways that we can help you is to kind of sift through what you've been reading and kind of give you some really scientifically backed ideas and methods to really treat this disease, because we don't want you doing anything crazy, and we can kind of help you. And just to mimic what Carrie and Lynn said, this is something that you're going to be living with forever. We want to make sure that you're able to have a good quality of life while you do that, and it's certainly possible. So I think that's my closing thought for today.
All right. It's a good one. Thank you so much. And Lorraine, what are your final thoughts?
I would say information is power. And so if you can have a session with a diabetes educator, I think it's wonderful. The more you know, the better decisions you can make for yourself, so you can steer your health in a very positive way.
Wonderful. Well, thank you all so much for your time and your knowledge. That's all the time we have for today. Thank you to our viewers for tuning in and for your questions. We do have various ways that you can learn more about diabetes and to schedule an appointment. You can call MedStar Franklin Square Medical Center, MedStar Good Samaritan Hospital, or MedStar Union Memorial Hospital. We'll post those phone numbers in the comments. And you can also visit us online, medstarhealth.org/diabetes. We'll post that link as well to learn more. Thank you so much for tuning in. Really appreciate it. And we'll see you next time.